If you're a man over 60 dealing with erectile dysfunction, urinary problems, or loss of intimate function, and you feel like your doctor's only solution is to hand you a prescription for medication without addressing the root cause of your problem, I need you to pay very close attention to what I'm about to share with you today. There are 5 specific pelvic floor exercises, sometimes called therapeutic movement techniques, that have been scientifically proven to restore erectile function, improve urinary control, enhance intimate performance, and even increase satisfaction for both you and your partner. Yet most urologists never mention these techniques to their patients. I'm Dr. James Whittaker, a board-certified physician with over 20 years of clinical experience, and today I'm going to reveal these 5 evidence-based exercises that can help you regain the function and confidence you thought were gone forever. These aren't gimmicks or unproven techniques. These are movements backed by peer-reviewed research published in major medical journals showing dramatic improvements in erectile function, urinary control, and intimate satisfaction for men over 60. Before we dive into these life-changing exercises, please hit that subscribe button and turn on notifications so you never miss any of my evidence-based health content. And I want you to drop a comment below letting me know what country you're watching from, because I love connecting with viewers around the world who are seeking real solutions to sensitive health challenges that doctors often dismiss or only treat with medications. Let me start by telling you about Michael, a 64-year-old retired engineer who came to see me about 18 months ago, absolutely frustrated and demoralized about his declining intimate function. Michael told me that over the previous 3 years, he had experienced progressive erectile dysfunction to the point where he could no longer achieve or maintain an erection sufficient for intercourse. He had also developed urinary problems including urgency, frequency, and occasional leakage, especially when he coughed or laughed. Michael had seen his urologist multiple times, and each visit resulted in the same outcome: a prescription for erectile dysfunction medication. While the medication helped somewhat, Michael wasn't happy about being dependent on pills for the rest of his life. The medication didn't work consistently, it caused side effects including headaches and facial flushing, and it did absolutely nothing to address his urinary problems. Michael asked his urologist if there was anything else he could try, any lifestyle changes or exercises that might help, and his doctor told him that at his age these problems were inevitable and medication was really the only option. Michael wasn't satisfied with that answer, which is why he came to see me seeking a different approach. When I evaluated Michael, I immediately recognized that his problems were classic symptoms of pelvic floor dysfunction, a condition that affects millions of men over 60 but is rarely diagnosed or properly addressed by conventional medicine. The pelvic floor is a group of muscles that form a hammock-like structure at the base of your pelvis, supporting your bladder, prostate, and rectum, and playing a critical role in erectile function, urinary control, and bowel function. As men age, especially after age 60, these pelvic floor muscles become weakened, uncoordinated, and sometimes chronically tight, and this dysfunction is a major underlying cause of erectile dysfunction, premature loss of erection, urinary incontinence, and reduced sensation during intimacy. The problem is that most doctors, even urologists, receive minimal training in pelvic floor dysfunction, and they don't think to assess or address these muscles when men present with sexual or urinary complaints. Instead, they default to the pharmaceutical approach: prescribe a pill and send the patient on their way. But here's what the research clearly shows. Pelvic floor exercises are as effective as medication for many men with erectile dysfunction. And unlike medication, these exercises actually address the root cause of the problem rather than just temporarily masking symptoms. I taught Michael the 5 exercises I'm going to share with you today, and I had him perform them daily for 12 weeks. Within 6 weeks, Michael noticed significant improvement in his erectile function. He was achieving firmer erections that lasted longer, and he was regaining confidence in his intimate abilities. Within 12 weeks, Michael's erectile function had improved so dramatically that he was able to reduce his medication dosage by half, and eventually he was able to stop the medication entirely while maintaining good function through the exercises alone. His urinary symptoms also improved substantially. He no longer experienced urgency or leakage, and his overall quality of life was transformed. Michael told me that he wished someone had told him about these exercises years earlier, because he had suffered unnecessarily thinking that medication was his only option. Now, before I walk you through the 5 specific exercises, I need to explain the anatomy and physiology of why these movements are so effective, because understanding the mechanism will help you perform them correctly and will give you confidence that you're not just wasting your time with ineffective techniques. The pelvic floor muscles include several distinct muscle groups. The bulbocavernosus muscle, which wraps around the base of the penis and is directly responsible for the rigidity of erections and the force of ejaculation. The ischiocavernosus muscles, which run along the sides of the penis and help maintain blood engorgement during erection. The pubococcygeus muscle, which is the primary muscle for urinary control, and the external anal sphincter and other deep pelvic muscles that provide structural support. When these muscles are strong, well-coordinated, and functioning properly, they perform several critical functions for sexual and urinary health. First, they compress the veins that drain blood from the penis, creating a valve mechanism that traps blood inside the erectile tissues and maintains rigidity. When these muscles are weak, blood leaks out of the penis prematurely, causing erectile dysfunction or inability to maintain erection. Second, these muscles create rhythmic contractions during orgasm and ejaculation, and stronger muscles produce more intense orgasms and better ejaculatory control. Third, these muscles provide support and compression around the urethra, giving you control over urination and preventing leakage. Research published in the British Journal of General Practice found that men who perform pelvic floor exercises for 12 weeks experienced a 67% improvement in erectile function, compared to only 20% improvement in men who received standard care without exercises. Another study in the Journal of Sexual Medicine found that pelvic floor exercises were as effective as erectile dysfunction medication for many men, but with the added benefits of improved urinary control and no side effects. So these exercises aren't alternative medicine or unproven techniques. They're evidence-based interventions that work by strengthening and retraining the exact muscles responsible for erectile and urinary function. Now let me walk you through the 5 exercises, and I'm going to give you specific instructions on how to perform each one correctly, how many repetitions to do, and how to progress over time. The key to success with these exercises is consistency and proper technique. You need to do them daily, and you need to make sure you're isolating and contracting the correct muscles rather than compensating with your buttocks, thighs, or abdominal muscles. Exercise number 1 is the foundational pelvic floor contraction, also called the Kegel exercise, and this is the building block that all the other exercises are based on. The first step is learning to identify and isolate your pelvic floor muscles. And the easiest way to do this is to imagine you're urinating and you want to stop the flow midstream. The muscles you squeeze to stop urination are your pelvic floor muscles. Another way to identify these muscles is to imagine you're trying to prevent yourself from passing gas. You'll feel a lifting and tightening sensation in your pelvic region. Now here's what's critical. When you contract these muscles, your buttocks should stay completely relaxed. Your inner thighs should stay relaxed. Your abdominal muscles should stay relaxed, and you should continue breathing normally throughout the exercise. If you find yourself holding your breath, tightening your buttocks, or tensing your thighs, you're using the wrong muscles and you need to refocus on isolating just the pelvic floor. Once you've identified the correct muscles, you're going to perform 2 different types of contractions because your pelvic floor contains both slow twitch endurance fibers and fast twitch power fibers, and you need to train both types for maximum benefit. For slow twitch endurance training, contract your pelvic floor muscles by lifting and squeezing, and hold that contraction for a count of 5 seconds while continuing to breathe normally. After holding for 5 seconds, completely relax the muscles for a count of 5 seconds, and this relaxation phase is absolutely critical. Many men make the mistake of never fully releasing the contraction, and this creates excessive tension that can actually worsen symptoms. That's 1 repetition. When you're first starting out, you may only be able to hold for 2 or 3 seconds before the muscles fatigue, and that's completely normal. Just work with whatever you can do, and the muscles will get stronger over time. Your goal is to gradually work up to holding each contraction for 10 seconds, with 10 seconds of complete relaxation in between, and you want to perform 10 repetitions of these sustained holds. This endurance training improves the stamina of your pelvic floor muscles so they can maintain the venous compression needed for sustained erections, and can provide consistent urinary control throughout the day. For fast twitch power training, you're going to perform quick, forceful contractions. Contract your pelvic floor muscles as quickly and strongly as possible. Hold for just 1 second, then completely relax for 1 second. That's one repetition, and you're going to perform 10 of these quick, powerful contractions in a row. This power training improves your muscles' ability to respond rapidly when you need them, like achieving an erection or preventing urinary leakage when you cough or sneeze. The complete foundational routine consists of one set of 10 sustained holds, where you hold each contraction for 5 to 10 seconds with 5 to 10 seconds of relaxation, followed by one set of 10 quick, powerful contractions, where you contract for 1 second and relax for 1 second. You should perform this complete routine 3 times per day, once in the morning, once in the afternoon, and once in the evening. And the entire routine only takes about 5 to 7 minutes each time. Within 2 to 4 weeks of consistent daily practice, most men start noticing improvement in erectile rigidity and urinary control. But the full benefits typically take 8 to 12 weeks to manifest, so patience and consistency are essential. Exercise number 2 is the bridge with pelvic floor activation, and this exercise combines pelvic floor strengthening with gluteal and core engagement to create functional strength that translates directly to intimate performance. Here's how to perform this exercise. Lie on your back on a comfortable surface like a yoga mat or carpeted floor, with your knees bent and your feet flat on the floor about hip-width apart. Your arms should be relaxed at your sides. From this position, you're going to perform a pelvic floor contraction just like you learned in exercise 1, lifting and squeezing those internal muscles. While maintaining that pelvic floor contraction, slowly lift your hips off the floor by pressing through your feet and squeezing your gluteal muscles, raising your pelvis until your body forms a straight line from your knees through your hips to your shoulders. Hold this bridge position for 5 to 10 seconds while maintaining the pelvic floor contraction and continuing to breathe. Then slowly lower your hips back to the floor and completely relax all muscles for 5 seconds. That's one repetition. Perform 10 repetitions of this bridge with pelvic floor activation. The reason this exercise is so effective is that it trains your body to maintain pelvic floor engagement while simultaneously using your gluteal and core muscles, which is exactly what happens during intimate activity. Many men have pelvic floors that don't coordinate well with their other muscles, and this lack of coordination contributes to erectile dysfunction and premature loss of function during intimacy. By training your body to maintain pelvic floor activation while moving and engaging other muscle groups, you're creating functional strength that directly translates to better performance. This exercise also improves blood flow to the pelvic region, strengthens the posterior chain muscles that support pelvic stability, and enhances mind-muscle connection, so you become more aware of and in control of your pelvic floor during intimate situations. As you get stronger, you can progress this exercise by holding the bridge position for longer periods, up to 30 seconds, or by performing single-leg bridges where one foot is elevated off the floor while you hold the bridge position with the other leg. Exercise number 3 is deep squats with pelvic floor engagement, and this movement is particularly effective for improving flexibility and range of motion in the pelvic region while strengthening the muscles that support erectile and urinary function. Here's how to perform this exercise. Stand with your feet slightly wider than shoulder width apart and your toes pointed slightly outward. Place your hands together in front of your chest in a prayer position or hold on to a sturdy surface for balance if needed. From this standing position, slowly lower yourself into a deep squat by bending your knees and pushing your hips back as if you're sitting into a chair. Lower yourself as deeply as you comfortably can, ideally until your hips are below your knees, while keeping your heels on the floor and your chest lifted. As you reach the bottom of the squat, perform a pelvic floor contraction, lifting and squeezing those internal muscles. Hold this position for 5 seconds while maintaining the pelvic floor contraction and breathing steadily. Then release the pelvic floor contraction, slowly stand back up to the starting position, and rest for 5 seconds. That's one repetition. Perform 8 to 10 repetitions of this deep squat with pelvic floor engagement. Deep squats are incredibly beneficial for pelvic health because they open the pelvic outlet, stretch the pelvic floor muscles and surrounding fascia, Improve hip mobility, which is directly connected to pelvic function. Increase blood flow to the entire pelvic region, and train your body to engage pelvic floor muscles from different positions and angles. Many men over 60 have tight, restricted pelvic floors rather than weak pelvic floors, and this chronic tension actually impairs function just as much as weakness does. Deep squats help release this tension while also building strength, creating a balanced, functional pelvic floor. If you have difficulty achieving a deep squat due to tight ankles, hips, or limited mobility, you can modify this exercise by placing a small wedge or folded towel under your heels to elevate them slightly, or by holding on to a sturdy surface for support while you work on gradually increasing your depth over time. The key is to go as deep as you can while maintaining good form with your chest lifted and your knees tracking over your toes, and to focus on the pelvic floor contraction at the bottom of the movement. Exercise number 4 is the pelvic clock, and this is an advanced awareness and control exercise that trains your ability to consciously direct blood flow and sensation to the pelvic region, which is critical for achieving and maintaining strong erections. Here's how to perform this exercise. Lie on your back in a comfortable position with your knees bent and your feet flat on the floor. Close your eyes and bring your awareness to your pelvic region. Imagine that your pelvis is the face of a clock, with 12 o'clock at your navel, 6 o'clock at your tailbone, 3 o'clock at your right hip, and 9 o'clock at your left hip. From this position, you're going to perform a pelvic floor contraction, but instead of a general squeeze, you're going to direct the contraction to specific areas of the pelvic floor in sequence, moving around the clock. Start by contracting the front of your pelvic floor, the area closest to your pubic bone at 12 o'clock. Focus your attention and your muscular effort specifically on this front region. Squeeze and lift for 3 seconds, then release. Next, contract the right side of your pelvic floor at 3 o'clock. Squeeze and lift for 3 seconds, then release. Then contract the back of your pelvic floor, the area closest to your tailbone at 6 o'clock. Squeeze and lift for 3 seconds, then release. Finally, contract the left side of your pelvic floor at 9 o'clock. Squeeze and lift for 3 seconds, then release. That's one complete rotation around the pelvic clock. Perform this clock rotation 3 times, moving slowly and deliberately around each position. This exercise might seem strange at first, and you might not feel much difference between the different positions initially, but with practice, you'll develop much more refined control and awareness of the different regions of your pelvic floor. The pelvic clock exercise is particularly valuable because it enhances your neuromuscular control, giving you the ability to consciously direct sensation and function in ways that directly translate to better erectile control and more satisfying intimate experiences. Research in sexual medicine has found that men who develop this level of pelvic floor awareness and control report significantly better erectile function, better ejaculatory control, more intense orgasms, and greater overall sexual satisfaction compared to men who only perform basic pelvic floor contractions without this awareness component. Exercise number 5 is the reverse Kegel with breathing coordination, and this is perhaps the most important exercise that nobody talks about, because it addresses the issue of pelvic floor overactivity and chronic tension that affects many men over 60. While the previous exercises focused on strengthening and contracting the pelvic floor, this exercise teaches you to consciously relax and release tension, which is absolutely critical for optimal function. Here's the reality. Many men with erectile dysfunction and urinary problems don't actually have weak pelvic floors. They have chronically tight, overactive pelvic floors that can't relax properly. When your pelvic floor is constantly tense, blood flow to the penis is restricted, the muscles can't contract effectively because they're already partially contracted at baseline, and you experience pelvic pain, urinary urgency, and sexual dysfunction. The reverse Kegel teaches you to consciously release this tension. Here's how to perform this exercise. Sit comfortably in a chair or lie on your back with your knees bent. Place one hand on your lower abdomen and one hand on your chest. Take a slow, deep breath in through your nose, allowing your belly to expand outward and feeling your lower hand rise. This is diaphragmatic breathing, and it naturally helps relax the pelvic floor. As you breathe in and your belly expands, consciously relax and release your pelvic floor muscles. Instead of lifting and squeezing as you do in a regular Kegel, you're going to gently bear down and release, as if you're allowing your pelvic floor to drop and soften. It should feel like a gentle letting go, not a forceful pushing. Hold this relaxed, released position for 5 seconds while continuing to breathe. Then exhale slowly and allow everything to return to neutral. Rest for 5 seconds, then repeat. Perform 10 repetitions of this reverse Kegel with breathing coordination. The key sensation you're looking for is a sense of release, softening, and letting go in your pelvic region. Many men describe it as feeling like their pelvic floor is melting or dropping away. This is the opposite of the tension and lifting you feel during a regular Kegel contraction. The reverse Kegel is particularly important to perform before intimate activity because it ensures your pelvic floor is relaxed and receptive, allowing maximum blood flow into the erectile tissues. Many men unknowingly tense their pelvic floor during intimacy due to anxiety or habit, and this tension actually prevents full erection. By practicing the reverse Kegel regularly, you train your body to release this counterproductive tension and allow natural function to occur. Now here's how to put all 5 exercises together into a comprehensive daily routine that will give you maximum results. Each morning when you wake up, before you get out of bed, perform exercise 1, the foundational pelvic floor contractions, 10 sustained holds and 10 quick contractions. This takes about 5 minutes and sets the tone for pelvic floor awareness throughout the day. In the afternoon or early evening, perform exercises 2 and 3, the bridge with pelvic floor activation, and the deep squats with pelvic floor engagement. These 2 exercises together take about 10 minutes and build functional strength. In the evening before bed, perform exercises 4 and 5, the pelvic clock, and the reverse Kegel with breathing coordination. These exercises take about 10 minutes and enhance awareness while releasing any accumulated tension from the day. The complete daily routine takes approximately 25 to 30 minutes total, spread across 3 sessions throughout the day. This might sound like a significant time commitment, but consider that you're investing half an hour per day to potentially restore function that you thought was permanently lost, to reduce or eliminate dependence on medication with its side effects and costs, and to dramatically improve your quality of life and your relationship satisfaction. Most men who commit to this routine start seeing noticeable improvements within 4 to 6 weeks, with maximum benefits typically achieved after 12 weeks of consistent daily practice. Now let me address some common questions and concerns that men have about these exercises. First, many men ask whether they should continue taking their erectile dysfunction medication while doing these exercises. My recommendation is to continue your medication as prescribed by your doctor initially, and as your function improves through the exercises, work with your physician to potentially reduce the dosage or frequency. Many men find that after 12 weeks of consistent exercise, they can reduce their medication by half or eliminate it entirely, but this should always be done in consultation with your doctor, not on your own. Second, men often wonder if these exercises can help with premature ejaculation as well as erectile dysfunction. The answer is absolutely yes. Stronger, better coordinated pelvic floor muscles give you much more control over the ejaculatory reflex, and many men who perform these exercises report significant improvement in ejaculatory control and lasting ability. Third, some men worry that if they stop doing the exercises, they'll lose all the benefits they've gained. The reality is that your pelvic floor is just like any other muscle group in your body. If you stop exercising it, it will gradually lose strength and coordination over time. However, once you've achieved good function through 12 weeks of intensive training, you can often maintain that function with a reduced frequency of exercises, perhaps 3 or 4 days per week instead of daily. But these exercises should become a permanent part of your health maintenance routine, just like brushing your teeth or exercising your body. Fourth, men ask whether they're too old for these exercises to work. The research clearly shows that pelvic floor exercises are effective across all age groups, and men in their 70s and 80s can achieve significant improvements in function. Your body retains the ability to strengthen muscles and improve neuromuscular coordination at any age, as long as you're consistent with the training. Fifth, some men experience temporary worsening of symptoms when they first start these exercises, and this is usually because they're overdoing it, using too much force, or not adequately relaxing between contractions. If you experience increased pelvic discomfort, increased urinary urgency, or worsening erectile function when you start these exercises, the first thing to check is whether you're fully relaxing your muscles between contractions. Many men get so focused on the squeezing and lifting that they never fully let go, and this creates excessive tension. If you think this might be your issue, spend a week focusing exclusively on exercise 5, the reverse Kegel with breathing coordination, without doing any strengthening exercises. Focus on consciously relaxing and releasing tension in your pelvic floor several times throughout the day. After a week of this relaxation practice, you can gradually add in the strengthening exercises, starting with very gentle contractions, just 5 repetitions once per day, and gradually building up from there. 6, men often ask about working with a pelvic floor physical therapist, and this is actually an excellent idea if you have access to one who specializes in men's health. Pelvic floor physical therapy has become much more mainstream and widely available in recent years, and a qualified therapist can assess your specific patterns of dysfunction, teach you proper technique with hands-on guidance, and develop a customized program based on your individual needs. Now let me come back to Michael's story and give you some additional details about his results, because I think it helps to see what's realistically possible. Michael started the exercise program I've described with absolute consistency, performing the exercises daily for 12 weeks without missing a single day. For the first 2 weeks, he didn't notice any obvious changes and was starting to feel discouraged. But I had warned him that it typically takes at least 4 weeks before improvements become noticeable, so he stuck with it. Around week 4, Michael noticed that his morning erections were becoming firmer and more frequent. This was an encouraging sign because morning erections are a good indicator of vascular health and nervous system function. By week 6, Michael found that he was able to achieve erections during intimate activity that were noticeably firmer than before he started the exercises, and he was able to maintain those erections for longer periods. By week 8, his urinary symptoms had improved dramatically. He no longer experienced urgency or leakage, and he felt much more confident in social situations where he used to worry about bathroom access. By week 12, Michael's erectile function had improved so substantially that he was able to reduce his erectile dysfunction medication from daily use to occasional use only when he wanted extra confidence for a special occasion. At the 6-month mark, Michael had stopped using the medication entirely and was maintaining excellent function through the exercises alone. He reported that his erections were firm enough for satisfactory intercourse. His ejaculatory control had improved, so he was lasting longer. His orgasms felt more intense, and his overall confidence and satisfaction with his intimate life had been completely restored. Michael told me that learning these exercises was literally life-changing, and he was frustrated that none of his previous doctors had ever mentioned this option to him. He said he would have started these exercises years earlier if someone had just told him they existed and explained how to do them properly. Now, Michael's results are excellent, but I want to be clear that not every man will achieve the same level of improvement. Some men will experience complete restoration of function like Michael did, while others will see significant improvement, but may still need occasional medication support. And a small percentage of men won't respond adequately to exercises alone and will need other interventions. The factors that predict success with pelvic floor exercises include the underlying cause of your dysfunction, your age and overall health status, the presence or absence of significant vascular disease or nerve damage, your level of consistency and commitment to the exercise program, and whether you're able to identify and correctly contract the target muscles. Men who have erectile dysfunction primarily due to pelvic floor weakness or poor coordination, rather than severe vascular disease or nerve damage, tend to get the best results from exercises. Men who are highly motivated and perform the exercises consistently every single day get much better results than men who do them sporadically. And men who take the time to really learn proper technique, focusing on isolating the correct muscles and coordinating breathing and relaxation, get better results than men who rush through the movements without attention to form. I hope this video has given you valuable information and practical techniques that you can implement immediately to start improving your erectile function, urinary control, and overall pelvic health. These 5 exercises represent evidence-based interventions that have helped thousands of men restore function they thought was permanently lost, and they could absolutely work for you if you commit to consistent daily practice. If you found this video helpful, please give it a thumbs up because it helps the YouTube algorithm share this information with other men who desperately need it but may not know these options exist. Make sure you're subscribed to my channel with notifications turned on so you don't miss future videos where I'll continue sharing evidence-based solutions for men's health issues that doctors often overlook or only treat with medications. Drop a comment below and let me know what country you're watching from. And let me know if you're currently dealing with erectile dysfunction or urinary problems, and whether you've ever been told about pelvic floor exercises by your doctor. I read every comment, and I love hearing from viewers about your experiences and your questions. If there are specific men's health topics you want me to cover in future videos, let me know in the comments and I'll do my best to address them. Share this video with any man you know who's struggling with erectile dysfunction or urinary problems, because this information could genuinely change their life and their relationship. These are sensitive issues that many men suffer with in silence, too embarrassed to talk about even with their doctors. But the solutions exist and men deserve to know about them. Thank you so much for watching. Take care of your health, and I'll see you in the next video.